Hi everyone, and welcome to this video. Today I would like to take a look at how the coronavirus is spreading in Iran. You might ask yourself, why am I choosing Iran today and not one of the countries that are being harder hit by the coronavirus? Now the reason is, first of all, the coronavirus was in Iran earlier than in most other countries, and as a result we have more data. And secondly, they had their interventions early on, so we actually have more data after the intervention, which hopefully will give us more reliable information about how this disease responds to interventions. And of course, I have many Iranian friends, and I'm actually curious to see how they are doing. So when we look at the data for Iran, and I fit my model to the data of Iran, and you can see the results here. And then currently, as of yesterday, there were 3,603 deaths in Iran due to the coronavirus. And let me show you some figures to see how the model fits to the data. So here the orange dots are the reported deaths in Iran as a function of time from late February until yesterday. And the blue dots are the model simulations. Now this is in log scale, so this is 10, 100,000 deaths as a function of time. And in a linear scale, this figure looks something like this. Let me move this a little bit. There we go. So we see a pretty good agreement between the reported data and the model. So based on the simulation, when we project this forward in time, what do we get? Well, as you can see here, the number of deaths will increase to rise until about the winter, and then it will stabilize at a level of about 13 to 14,000. So my projected number is 13,676, with a lower limit of about 7,500 and an upper limit of over 50,000. So Iran is not out of the danger zone yet, clearly, considering this upper limit. But what we can say is that it's very likely that Iran is going to end up with much more favorable numbers than the countries that I've discussed so far, particularly Spain and Italy, and probably much better than most European countries and North America. So that is definitely good news for the Iranians. But I am a little concerned, and the reason why will be clear when we look at the day-to-day data. As you can see here, we have the daily number of deaths as a function of time. Again, the orange line is the reported data. The blue line is the model. This looks very flat here. Now, a flat horizontal line indicates an R0 of 1. An R0 of 1 means we're on the cusp between controlling the virus and not controlling the virus. And that's why I'm worried that Iran is not out of the danger zone yet. We see the last 2 days here, the numbers were above the model data, and I'm hoping that's just coincidence because this is going up and down. But it's not actually clear yet. You see there's a little bulge here. It's not possible to fit the bulge over here in the model without overshooting the rest of the data. So this might have been some incident, maybe a gathering where a lot of people got infected about here, maybe late February, which might have led to a lot of deaths towards the end of March, and that might have been this bulge here. But if that bulge is kind of an outlier, then maybe there is actually an increasing trend. Who knows? So that is something that we will have to follow up in the next couple of days, and hopefully we will see a more clear decline in the number of deaths in days to follow. Now, assuming that this fit is the correct one, what else can we say? Well, my model predicts or indicates that about 100,000 lives have been saved by the non-pharmaceutical interventions that have been taken in Iran. So that is good news. Now remember, as I said in previous videos, the number is probably an overestimate because the Imperial College model gives a much lower estimate for the countries where I've done simulations, where they've done simulations as well. In terms of R0, we see that before interventions, the R0 was about 3.2, which is substantially lower than both Spain and Italy. And that was probably one of the reasons why they were able to intervene effectively, because the disease was spreading more slowly, which gave them a little more time to react than in the countries where it was spreading really fast. After intervention, my estimate is 0.867, but as I said, it could actually be about 1 or slightly above 1. In terms of effectiveness, this is 73%, so it's actually less effective in terms of a percentage of the initial R0. So, but it looks like the overall result is good. The R0 is below 1. So far, 58,000 cases have been reported. I estimate that the actual number of people who have caught the coronavirus in Iran is about 450,000. And I estimate that by May next year, that number will be on the order of 900,000 people. These numbers are much, much lower than the ones in Italy and Spain, despite the fact that Iran is a much more populous country, is a country of 83 million. Spain is 46 million, Italy is about 60 million. So let's look at some of the other data. The number of reported cases, my estimation based on the model is that 1 out of 5.8 people who have the virus have been reported. And I'm a little worried about this spike here. So the number of reported cases has increased very steeply since about the last week of March, say about since March 24 approximately. I hope this is due to an increased amount of testing, and maybe people from Iran or who are in contact with people in Iran can let me know if this is indeed the case. Have the authorities started doing more testing since March 24? If that's the case, then that's a good thing. That means they have a better information. The quality of information is increasing. I hope it's not because of a relaxing of the social distancing measures, because that would be bad news. That would indicate that there is indeed a renewed spread of the virus. So please, if you have any information about that, let me know so that I can adjust my conclusions if necessary. So let's take a closer look at the active cases. My model predicts that we're right at the peak of the active cases, and it looks like the reported cases is bearing that out. Yesterday, the number of active cases barely went up, and I think it's actually not going up at all today. So that seems to indicate that the model is correct, that Iran is turning the corner right now, and that we're going to start seeing a decline in number of cases right now. The model indicates that there is about 10 to 12,000 people who need hospitalization. That is actually quite a low number for a country of 83 million compared to other countries. So that is good news. It means that this is a number that a country can manage relatively well. And then, as I indicated, this is the total number of cases that I predict with my model, so about 450,000 right now, and it's going to increase up to about 900,000 sometime next year. Again, I've tried to take this data out of the world data, so I have made another rest of the world calculation, and I don't want to say too much about that. These numbers are getting worse and worse as we are taking success stories out of the data, the average of what remains is just getting worse and worse. I think the main message here is that we need to do more work in other countries where the virus is spreading unchecked. And if we don't do that, the result will be catastrophic, with tens of millions of people dying. So hopefully we can do something about that, and we can get the word out to those countries that something needs to be done, because the repercussions are going to be horrendous if we don't do that. Okay, I don't want to end on a down note, so let me go back to the results of Iran. I'm glad to see that Iran is most likely turning a corner, that the number of deaths is going to be substantially less than in a lot of European countries, so that's good for them. It's kind of sad that most Western governments have actually performed markedly worse than the Iranian government. I think that's a sad conclusion for Western democracy. It's definitely a failing for Western democracy that we have not been able to take this seriously enough, whereas the Iranian government clearly has taken it more serious. I know some people are going to ask me, do you really trust the data of Iran? I don't know. All I can say is that the data, I can model the data quite well with the model. To me, that is an indication that there is definitely some level of reliability in the data. If people know more about the local conditions, you can always let me know or comment, and I can always try to make adjustments to the model based on any information that people might have. But that is my conclusion. It looks like Iran is turning a corner. It's not out of the danger zone, so the social distancing and physical distancing measures need to be continued for quite a long time, I'm afraid, before this will be under control, but things are going in the right direction. And with that, I would like to conclude this video. I will look at more countries in days to come. Let me know which country you would like me to take a look at, and I hope I will see you in a future video.